My name is Annie Tomlinson, and I am part of the CON team for the debate question, Ethical Treatment of Mental Health Problems Requires a Formal Diagnosis. I will be addressing the points made by the opposing team and poking some holes in their arguments. The opposing team had two main points, which were that misdiagnosis and mistreatment can harm an individual and contribute to an increase in serious negative consequences. The second point they made is that there is a high incidence of treatment gaps experienced by individuals with mental disorders. I will address your first point, that mistreatment and misdiagnosis can harm an individual and lead to serious negative consequences. Your team brought up the treatment differences between depression, bipolar, and borderline disorder. According to the article you cited, Antidepressant-Induced Mania and Cycle Acceleration, a Controversy, Revisited, states, an incorrect diagnosis of unipolar depression carries the risk of inappropriate treatment with antidepressants, which can result in manic episodes and trigger rapid cycling. I'll make a point that this was a citation within a citation. So I can concede and agree to your point that prescribing medication without a formal diagnosis could be seen as unethical and lead to a worsening of conditions. However, medication is just one aspect of therapeutic treatment. There are many psychosocial treatments for borderline and bipolar disorder, such as dialectical behavioral therapy, cognitive behavioral therapy, and family therapy, all of which are useful in treating a wide array of difficulties. And according to research done by Dr. Zimmerman in 2015, accurate and comprehensive diagnostic evaluations are not critical after gross diagnostic class distinctions are made, such as differentiating between a mood disorder and a personality disorder, as would be the case between bipolar and borderline personality disorder. When examining your first article, Bipolar Disorder and Borderline Personality Disorder, I found that the author himself concludes at the end of his article, in quote, as you can see, overall my recommendation is that you avoid getting too stuck on a diagnostic label. Earlier in the article, he talks about the pitfalls of being misdiagnosed and says, an example, you're really bipolar, but you get diagnosed borderline. Even if you were initially treated with psychotherapy, ideally it would be noticed that you are not improving fully and might need medication treatment as well. And hopefully, since mood instability is your primary problem, not plain depression nor psychosis, you would then be treated with mood stabilizers. The point here is that you would not necessarily be led into a treatment that can harm you with the wrong diagnosis either way. You might well get a treatment that could be helpful, even if it is not the core treatment you will eventually need and hopefully get. So even he says don't get too caught up on a formal diagnosis. Your second point is that a delay of diagnosis causes a treatment gap. The first thing I noticed is that your study on treatment gaps was from 2004, which could mean that the information is fairly old and could be outdated. In regards to the prevalence of treatment gaps due to lack of mental health diagnosis, we are not arguing against treatment. We are saying that treatment is ethical without a formal diagnosis. A lack of a formal diagnosis is not the same as misdiagnosis, and failing to diagnose is not the same as failing to treat. So in this case, I think you're changing the conversation instead of addressing the prompt directly. According to the article titled Your First Psychotherapy Session, which is basically a guide to your first psychotherapy session as a patient from Psych Central, it states many clinicians take their time in arriving at a formal diagnosis in the early stages of therapy. And because these issues are so serious and complex, it may require multiple visits and time to diagnose and treat a patient most effectively. Unfortunately, due to insurance companies, many therapists have to come up with a tentative initial diagnosis that is flexible to change, that they are also sometimes unwilling to even share with their patients because they're worried about the negative repercussions of applying a diagnostic label. I agree that mental health issues are serious and dangerous issues, and that an individual needs to be aware and educated on the specific facets of what they are struggling with. But I also believe that treatment is possible and ethical without a formal diagnosis, and that there is harm in over-focusing on labels instead of treatment. To reiterate from our opening statements, we believe that our position should win for the following reasons. 1, mental health is stigmatized in our society, and persons often react negatively to receiving a formal diagnosis. 2, diagnostic criteria according to the DSM-5 is too strict and often creates unnecessary barriers to treatment. And 3, ethical treatment involves the use of certain guiding principles that can be applied universally and irrespective of diagnosis. I hope that you enjoyed our presentation and that you can see that ethical treatment of mental health problems does not require a formal diagnosis, and that people can receive help even without a formal label attached to their problems. Thank you for your time.